quinoxetv.
Good day, ladies and gentlemen. Thank you so much for joining me on yet another edition of the program You and Your Health aired on Equinoxe Radio Multimedia. For presentation, I am Immaculate Fogwe. Cervical cancer is the 8th most common cancer in the worldwide and the 4th most common cancer among women. In 2022, an estimated 660,000 women were diagnosed with cervical cancer worldwide, and about 350 women died with this disease. With a comprehensive approach to prevent, screen, and treat cervical cancer, how then can we better eliminate this particular disease? That's what we'll be talking about on today's edition of the program. So my guest today is Dr. Simon Pechulano. He is a medical expert and also a researcher. It's a pleasure having you on the program today.
Hi, Immaculate. Thank you very much for having me. It's my pleasure.
Doctor, we often hear about cervical cancer, but a lot of people have very limited knowledge about this. What should come to our mind whenever we hear about cervical cancer?
Well, cervical cancer is a unique cancer in the sense that it is very deadly but very highly preventable. And it's one of the few cancers that you can treat completely. Yeah. And prevention is also easy.
Now you said prevention is easy.
Yeah, now, if you're with education.
Okay.
Yes, with knowledge about it, vaccination and school.
Now, what are the primary risk factors associated with this disease?
Well, cervical cancer, just like any other cancer, affects the cervix. The cervix is the lower portion of the womb that connects to the vagina. The birth canal, let me put it that way. And it is caused by a virus called human papilloma virus, which can be acquired sexually. So this cancer can be acquired sexually. And the risk factors, one of the most important risk factor is the acquisition of the virus that causes it, human papilloma virus. Other risk factors are secondary, like poor immunity, multiple sexual partners. For example, if you have more than one partner, there's a high risk that you get the virus through sexual contact. We say smoking, which is not really so much our problem in this part of the world. That's something in the Western world. HIV infection, which is part of low immunity. When your immune systems are low, it is also a higher risk for you to have the cancer of the cervix.
Now, talking about the symptoms, how can someone tell she's suffering with cervical cancer?
Yes, that is a very, very important aspect of the cancer of the cervix. Initially, there are no symptoms. And that's why we go all out to try to screen people and so on. But at the late phase, which is a phase that most medics would not like to get there, it presents with, bleeding, especially after sexual exposure, pre- and post-menopausal bleeding. For example, a woman that has stopped bleeding because of menopause starts seeing spots of blood, presents with vaginal discharge, foul smelling, suprapubic pain. You can have some unexplained suprapubic and waist pain, which you have made all kinds of tests and you're not. It could be cancer of weight loss, fatigue, complete chronic presentation where you see a person and you just see this person is sick, but you cannot particularly pinpoint. Yes, it could. Most of the time when we screen for cancer of the cervix, you just see that this person probably has cancer of the cervix.
Now, when diagnosed with this particular disease, what's the next step to take?
Well, it depends on the stage. Cancer of the cervix, you have pre-invasive cancer of the cervix, which is a very, very important aspect of our talk here. We will want everybody to be seen in the hospital with pre-invasive.
Okay.
Meaning that it has just, the virus, human papilloma virus, is on the cervix trying to take hold of the cervix. But yet, the cervix is not cancerous. They call it CIN 1, 2, 3. So once you have pre-invasive, it's easy. We could treat it with multiple ways of treating. Thermocoagulation, which is what we use mostly in our center. You just, you use an instrument that you would just burn the cervix, burn the cells of the cervix, and that comes out like vaginal discharge. And within 2 months, the woman comes and she's completely cured of it.
Wow.
Yes, completely.
Wow.
So most of the time, if you screen 10 women, 1 out of 10 has a pre-invasive cancer of the cervix. And then the full-blown cancer of the cervix, the invasive, if it's stage, because it could be stage 0, stage 1, stage 2, stage 3, stage 4. Okay. Stage 1 is stage 1A, stage 1B, stage 2A. So the first stage 0, stage 1, stage 2A, stage 1A can be treated with surgically. You just remove the cervix, you remove the womb, you remove the tubes, you remove the ovaries. They call it total abdominal hysterectomy and bilateral salpingography. Yes. Wow. The woman will be completely cured.
So that means there's a cure for sure, but when it's at the early stage.
That's the early stage. So when it's beyond that stage, it's chemotherapy, radiotherapy.
And it's quite expensive too.
Yeah, it's not only more expensive. Any doctor anywhere in the world will not be able to do anything much. Wow. They can only prolong your life. So that is why we are talking about screening. We don't want anybody to get to that stage because it's pathetic. Yes.
Now, as a doctor who works on the field with some of these patients, what's the prevalence rate of cervical cancer, let's say, in the case of Cameroon?
Yeah, in Cameroon, I know that, although we don't have a solid research on that, but at least we see the prevalence rate is high, but not as terrible as the pre-invasive. And particularly, I can say that most of the time, if I see 10 women who are coming in for screening or 20, 2 of them will have pre-invasive cancer of the cervix.
Wow.
But the full-blown cancer of the cervix is rare. Maybe 100 women, you see like 1 or 2, 1 or nothing. Yeah, so in 2022 or so, about 2,000, according to 2,700 women or thereabout had cancer of the cervix, full-blown cancer of the cervix in this country, and 1,700 died.
Wow.
So, so that is the prevalence. Prevalence is at any point in time, how many people have this disease? Yeah, incidence is how many people are adding to the number of people that already have the disease. So the prevalence is high. It's high, especially in the less, in the poor communities in our country where they don't know about they don't really have not been really educated about screening and other things that can prevent it.
For those who like to participate in the program, here are the numbers: 670-5470-49. I repeat, 670-5470-49 or 656-622222. 656-622222. Back to you, doctor. You talked about the first stage and the second stage being able to be, that it can be treated.
Yes.
How much can this treatment cost?
Here is in the neighborhood of 1.5 million plus or minus.
1.5.
Depends on it depends on the patient. Sometimes medical bills are not static; they are not.
Yes, it depends on the
hospital. You just look at some patients, and but if the person can afford, we will ask between 1 and 1.5 million to treat that total abdominal.
Is it complete treatment?
Yeah, honestly, you can actually, once you remove the cervix itself, you remove the womb, which is connected to the cervix, because the cervix is the lower portion of the womb.
Okay.
Yes, you remove it, you remove the tubes, and then you remove the ovaries.
Wow.
So
So definitely at that type of point,
Yeah.
a woman is unable to.
Oh no, that's complete now.
Okay.
You are trying to save the woman's life so that she
Yes.
can take care of perhaps 1 or 2, 3
For
children
sure,
that
for
she
sure.
has.
Okay.
It's better.
For sure.
It's
Life
better.
is very important.
Yes.
Now, how effective is the HPV vaccine?
Oh, it's very effective. That's why in the Western world, a country like the United States of America, less than 10,000 people die of cancer of the cervix. Meanwhile, in sub-Saharan Africa, which is almost like the population of the United States, you have 600, just like you said, 660.
We have 660,000
people that
diagnosed.
are diagnosed with
Exactly.
it. In the U.S., less than that, because there between the age of 9 and 14, both boys and girls are given
The vaccine.
human papillomavirus vaccine.
Why this particular age?
Yeah, because there I presume that they have not been sexually exposed. Because the people that are exposed, once you get the virus, yes, the vaccine is not really. Yeah, vaccine is you are putting the microorganism into the body to provoke the body to produce immunity against that particular microorganism.
Okay.
So if you have already been sexually exposed, and it's a very common virus in the sense that a woman's lifetime, between the time you're born to, almost 90% of women have been exposed to the virus.
Wow.
It's just that people have different immune
systems.
Yeah, so the immune system takes care of it. So
now let's look at the lifestyle changes for women who are suffering with this situation of cervical cancer. What are some of the lifestyle changes they need to make?
Well, you mean people to lifestyle changes to prevent it?
No, for those who are suffering with the disease.
Yes, try to first of all, you have to be regular with your medic so that it will guide you. You have to exercise is a great thing for everybody. Diet is a great thing for everybody. You try to adjust your diet, you adjust your exercise psychologically. For us here in Africa, go to church and let them pray for you and be we have to be practical because your emotional state affects every disease entity in your body.
Apart from sexual intercourse, what are some other ways to prevent ourselves from suffering with this or developing such a disease?
Well, the sexual intercourse, it actually is the main.
Okay.
Because that is where the virus is transmitted.
I see.
So the others are just secondary. Yeah, if you can reframe that question again, let me get it.
No, I've understood now. That means that's a major way of getting this particular virus.
It's 90% of cancer of the cervix, 98% of cancer of the cervix is gotten by the presence of human papilloma virus, which is we have more than 150 different strains. But the ones that really cause this disease is type 16, 18, 31, 35.
Now, we often get the cancer of the cervix. When it comes to the men, what do we talk about?
Honestly, it is where you see the human anatomy, the female anatomy is predisposing, is exposed to the virus surviving there.
Wow.
The men are the people that actually transmit the virus.
That's not fair.
But they are not affected. So because of the anatomy.
Okay.
Yes.
So any last word for, we have a call on the line. Hello?
Hello?
Yes, sir. Good afternoon.
Good afternoon, madam.
Your name, where you're calling from, and your question, please.
I'm calling from Naples.
Okay, sir. Your question.
My question is that some people are saying one of the preventions to suck a woman's breast is how that.
We didn't get you clearly, please. Can
That
you?
one of the is to suck the woman's. When you suck the woman's, it's one of the prevention.
Like when you, we can't get you. The network is not really the best. Did you even get him somehow?
No.
I myself, I didn't get him clearly. We are so sorry, but the network wasn't the best. So any last word for those experiencing this particular, let's say, very difficult situation for these people going through this at this moment with cervical cancer? Last word for them?
Well, my last word for them is they should take heart. Everybody will die someday by a particular, it may not be a disease, it may even be an accident. So they should take heart, take their drugs, and then I will pray that their family members should give them the kind of support that will help them transit. Because when you have cervical cancer, the ultimate, yes, full-blown is dead, but all of us will one day die.
For sure.
But for those of us and those other people that do not have it, this is a disease, a very serious health concern for everybody. Because if your mother has it, you have it. If your wife has it, you have it. If your sister has cervical cancer, you have it. Because you will be affected one way or the other. Your money, your psychological state, all this. So it is a fight for all of us that we, according to WHO Millennium Goal of 2030, we should eliminate to a certain extent this condition that is highly preventable.
Thank you so much, Dr. Simon Pechulano, for being part of the program. And that's all put an end to today's edition of the program. Done for presentation, I am Immaculate Fogwe, and I received technical assistance from Luis Pego and Jonathan Babiola. Have a lovely day in the company of more interesting programs on Equinoxe Radio and, of course, television. Bye-bye for now.